Applies compression is another test that we're going to do for meniscus. What we're going to do is we're going to take the involved knee and we're going to bend it up like this. What we want to do now is we want to put some compression into that joint to see if there's any meniscal problem, and we're going to add some torsion at the same time. So I'm going to come right over the patient. I'm going to grab proximal to the ankle, and with my body weight, I'm going to come down on the patient's knee just like this, and I'm going to turn the tibia external rotation, and then I'm going to turn it into internal rotation. Now, when we're turning into external rotation, that's testing our medial meniscus, and we're doing the internal rotation. That's the lateral meniscus. And so that's the prone test. We have a couple for supine, so we're going to have our patient lay supine for us, please. First one we're going to do is McMurray's. In McMurray's, there's a lot of variety in McMurray's test. So basically, we sort of settled on performing it this way. We're going to bring the patient's knee up to 90 degrees, their hip at 90 degrees, and we're going to be going from internal tibial rotation to external tibial rotation. While we're in those rotations, we're going to be adding varus and valgus stress and then straightening the hip and the knee. So first thing I'm going to do is I'm going to do internal tibial rotation. You can see the heel is going lateral, so we're testing the lateral meniscus. Then what we're going to do is we're going to add some valgus stress, and we're going to straighten this out and see if we have any pain or abnormal clicking sensation in here. Then we're going to add the same thing, staying with the internal tibial rotation, we're going to add a varus stress, and we're going to bring it down like this and take it back up. We're going to then switch over to an external tibial rotation. You can see the heel is going medial, and that's going to be testing our medial meniscus. And we're going to again do these same mechanisms again. We're going to be adding the valgus stress, and again, we're going to add the varus stress. Another test that we're going to do is called the bounce home test. Basically what we're going to do is we're going to just take the patient's knee. I'll do it on this knee so you can see it. We're going to take the patient's knee, and we're going to flex the patient's knee. We're going to keep the leg off of the table, and we're just basically going to let it drop. And it should drop into full extension. If it doesn't drop into full extension, it could be meniscus, and generally that's what we think. But there are other things too that could inhibit the knee from fully extending. One of those would be osteochondritis dissecans, if there were joint mice within there. That may inhibit that as well. What we're going to do now is we're going to do Thestley's test, and this is for a meniscus. And Thestley's is a very, very highly rated test. They say the value of it is very high. If you have a positive Thestley's, then there's a very, very strong chance you absolutely, but you'll have a meniscal problem. So what you're going to do is you're going to have the patient, and you're going to stabilize your patient like this. And let's just say that our patient's having trouble with their left knee, some pain. We want to roll out a meniscal problem. Of course, you always start on the uninvolved side, but we're going to go straight to the involved side. And we're going to have our patient bend their knee. There you go. And we're going to just basically have them twist back and forth on it and grind on that a little bit. And we're going to ask them if that causes them any pain. If that causes them pain, yes, then wear. And if it's at the joint line, then you know you have a meniscal problem. If that does not cause them pain, what we're going to do is we're going to have them actually bend a little further and then do the same mechanism. There you go. And if that causes them pain, again, meniscus, no pain, probably not a meniscal